back at some point in early July, we had the coalition, through myself and CTA, had requested some data relative to vacancy savings, funded positions that ultimately were not staffed, and what that led to in terms of unspent funds for the district. The district had replied that roughly $78 million from last year were unspent on budgeted FTE. The district also provided a number of expenditures that the district had decided to take that would eat into that $78 million, but ultimately, after all of those identified expenditures, the district still had an estimated savings on that original $78 million of $14.6 million. So the coalition has met and unanimously has taken the position that for this year, that some or all of those funds be used to float the potential increases from the proposal from the district, and that the possibility of out-of-pocket increases for employees be revisited for the 25 healthcare year.
I can't weigh in specifically on these costs, but I think, Heather, you probably can best, right?
Based on looking at our health plan, the $30 million is not even going to be sufficient to cover the shortfall. We are required by state statute to have a reserve set aside because we are self-insured for, I believe it's 60 days. And I mean, we are at risk for hitting that amount. So taking $15 million of one-time money is not something we can do. We have to make sure that our plan, our self-insurance fund, is structurally balanced at some point. Even looking at the projection that I prepared that hasn't been updated, we have a projected increase of 2.2% of claims. I think we can all agree, based on the trends that we've been sending out, the actual health claims each month, we're trending at 8%, which is well above the 2.2% in the projection. And utilizing the projection, we're still at a shortfall after 3 years. So the district does hear you and did, in a sense, already agree that we're putting in $15 million this year. And starting in July, we're not waiting until January to increase our premiums. Well, we're actually waiting till January 1st to officially increase our premiums, but we're going to transfer in an additional $7.5 million to cover the first part of the year from July through December. So we are taking $7.5 million and infusing that into the plan early, whereas we're not starting with the employee increases until January 1st. So the district is putting in $15 million in FY24 and is only asking for, phasing it in over the 2-year period, employees to put $7.5 million in for that, for the fiscal year 2024.
Understood. And in debating the position that the coalition took, we see the tables, we understand what's before us. The question, though, that we deliberated over was whether or not the burden should be borne by the employer or the employee, which is a subjective question more so than whether or not the dollars have gone up on the table. And the coalition's position at this time is that with the identified funds, that we believe that it can be floated for at least one more year to revisit it.
I think we talked about this last year where we said, our actuary came in and said we need to increase this last year. We said we brought that forward. We ended up holding firm for our 10th year to say no increases. And we've brought some options here today. We negotiated the targeted outcomes to make it easier for people to hit the healthy rewards. But we're at some, an increase. We're saying we need to increase, but all we keep coming back to is no increase. We're not really negotiating here. It seems as though, you know what I mean? It's just, this is year 2 where we're again saying no increases and there's no movement at all. And we're saying we don't have that luxury. We'd love to. I'd love to. I have to pay these too. But we're not really moving anywhere where we're saying, yeah, we're acknowledging that. I mean, we can't ignore that the cost, the claims, they're higher than they've ever been. This past month, is this the highest ever? I think it was, or at least one of them. We've kicked it now for over a year to say, all right, we're going to hold, but we're at that point where we really do have to increase them. So, but I'm not hearing from anybody that, willing to present something else other than no, nothing.
Well, and to be truthful, the coalition's first position was that there were $78 million available through the one-time savings that could be banked to float costs for a number of years. We chose not to focus on that part because the district, through the breakdown provided, had chosen prior to coming to the table in this particular negotiation, as is their right, to allocate $63 million of those dollars. So we're basically asking for the remainder, as identified by the district, to cover those costs. Had that $78 million in unspent funds that was budgeted for FTE that were not able to be filled, but the work was done by the employees who took on the extra work and the extra student populations and so forth based on those vacancies. If that $78 million were on the table, then our plan could have been to float the employees' potential share for years. But a significant percentage of that was already earmarked. And again, we're not debating or fighting over that, but we do identify what has been told to us as $15 million in what would have been funds for employees to pay them, albeit that are available, in our view, for this particular expenditure.
And we did set aside $15 million for health premiums in the upcoming year. And if you want to, those are also one-time funds. So when you have an increase, a recurring increase, and you use one-time funds, eventually it needs to be paid. And so it's not solving the problem, and it's actually even causing a larger increase for employees at the end of the day. And if you go back and look at the years where the district, so over the past 10 years, we haven't seen an increase in employee premiums, but you see that in plan year 12, 13, and 19, the district increased their employer premium. So there have been increases over the year that the district has borne. And so now we're at the point where we do need to share that increase with employees because the district has absorbed the burden. And this year we took, and what the board chose to do is to put additional funds within the raises for employees as well. Because there is, at the end of the day, one pot of money that we're working with.
Understood. At least at this time, that is the position of the coalition.
So there's no other options on the table. It's all nothing, zero, where employees are contributing zero.
For calendar year 2024, that is the position to utilize some of the $78 million in one-time savings to float those costs. To your point, that's not a permanent solution, but we negotiate healthcare on an annual basis, so it means that next year is another opportunity to look at potential changes.
Heather, can you and I step outside? All right. Well, we heard your proposal or your position on this, so we're just going to take it back to our team, and we will get back to you, all right?
Okay, thank you.
Thanks.